my name is Eleanor, and I'm going to be your nurse today. We're going to be performing an abdominal assessment. Normally I would have you bare your skin for this type of an assessment, but due to privacy concerns, I'm going to have you keep your clothing in place. So first I want to ask you a couple of questions. Do you have any nausea or vomiting? Has your appetite changed in any way? And when was your last bowel movement? I'm going to perform hand hygiene before we get started. The first part of the assessment is the inspection. So I'm going to have you lay supine with your back flat against the bed. First, I want to look for the contour of your abdomen from two different angles, one from your side and one from below your feet. I'm looking for symmetry, whether your abdomen is flat, rounded, or distended. I'm checking the color of your abdomen as well, seeing if there's any venous patterns or dilated veins. I'm checking for any lesions or scars. I'm checking the placement of your umbilicus, whether it's midline, inverted, or everted. I'm also going to be looking for any movement of peristalsis or pulsation of your abdominal aorta. I'm going to move the inspection part for the hernia to the palpation portion of the assessment. Next, we're going to auscultate your bowel sounds. Using the diaphragm of my stethoscope, I'm going to start in the right lower quadrant and go clockwise. I'm listening to see if your bowel sounds are present, hyperactive, hypoactive, or absent. If they're absent, I have to listen to each quadrant for 5 minutes to determine that. Next, I'm going to switch to the bell of my stethoscope and listen right below your xiphoid process to under your umbilicus, and I'm checking for a bruit in the abdominal aorta. The next part of the assessment is percussion. So I'm going to start in the right lower quadrant and go clockwise. Starting with 2 fingers in one hand and the other 2 fingers in my other, I'm going to tap in each quadrant. This is checking the density of your tissues. The GI tract has a lot of gas in it, so this makes a more low dense tympany. The next part of the assessment is now palpation. So we're going to check for the hernia. You can either lift your head or bear down like you're having a bowel movement called a Valsalva maneuver. This increases the abdominal pressure, making hernias more visible and easier to feel. So I'm checking around the umbilicus and then also in the bilateral groins. You can lay your head flat now and bend your knees up. I'm going to palpate from the right lower quadrant and going clockwise. This is a light palpation, so it's only going to be one hand depressing about 1 centimeter. I'm checking your face and looking for any kind of tenderness that might be present. I'm also checking for rebound tenderness, where I would put my hand down and when I release, see if there's pain present. This would indicate rebound tenderness. Now we're going to move on to the last portion of our assessment. I'm going to have you sit up with your back facing me. With a flat hand, I'm going to place it over the location of your kidney, and with a fist in the other hand, strike my flat hand. I'm going to do so on the other side with the other kidney. This should be a painless procedure. If there is pain or tenderness felt, this is abnormal and could mean inflammation in the kidneys. This is the end of the assessment. You can gown back up. I'm going to perform hand hygiene, and is there anything else I can bring you? All right, thank you.